There's a dangerous TikTok trend happening right now. Some videos are encouraging teens to take Benadryl to get high. A teen's mother in Myrtle Beach says this is what her child did and then started hallucinating. Her heart rate spiked to nearly 200 beats per minute, which is very dangerous. Luckily, that mother was able to rush her daughter to the hospital, and she is now making a full recovery. So today we're fact-checking how much Benadryl is safe to take. So I'm here with Dr. Bijoor. She's a family physician from Oakview Medical Associates in Greenville. Thank you so much for being here today.
Thank you for having me.
So let's first start with how much is safe to take for a child and how much is safe to take for an adult?
That's a great question. First of all, I must say that you must talk to your physician before you yourself take Benadryl or give it to your child. Under 2, definitely not, but 6 to 11 years of age, there's a recommended dosage, which is 12.5 to 25 milligrams per dose, and that can be given every 6 to 8 hours. Like I said, the maximum dosage guidelines are there, and then for 12 and up, it's 25 milligrams and up. Adults can take up to 50 milligrams per dose.
So when we're talking about the pink pill,
yes,
how many pills is that for an adult?
So one pink pill for a child, the chewable, is 12.5 milligrams, and for adults, it's 25. So 1 to 2 of those.
So
for
1
adults.
to 2 of those for an adult,
yes,
no more than that in a 4 to 6 hour period.
Correct.
That's recommended.
That's why it's 25.
Now, why can a large amount of Benadryl cause hallucinations or a fast heartbeat?
So diphenhydramine, which is the chemical word for Benadryl, is a centrally acting anticholinergic. So what that means is it crosses the blood-brain barrier. So when you take the pill, it goes through the blood-brain tissues, and it can be it's anticholinergic, which means it can cause some side effects, and if taken in unregulated doses, it can be pretty dangerous.
Now, is it recommended to take this for sleep? I know a lot of people do.
So it's not recommended for long term. People do take, they tell me, I just take Benadryl every night to help me sleep. It's definitely not recommended for that. Short term, because it is antihistamine, so it does block the histamine receptors that can cause you a little drowsiness. So that's why it's an associated side effect that we're using to take Benadryl. But actually it's for allergies. If you get a rash or something, it's for that, but must be taken under physician guidance. It can have, in higher doses, it can cause hallucinations, confusion. It can cause dryness of the mouth, dilated pupils, urinary retention, and so it can be pretty dangerous. It can also cause respiratory depression and death, as we know some of the deaths that occurred. Yeah.
Now, can people become dependent on Benadryl?
So not dependent like alcoholism, but in the sense it can cause psychological dependence, almost like a crutch. Oh, I can't sleep, I have to have my Benadryl. So I hear my patients will say, I need to take something just to kind of help me rest at night, mostly for racing thoughts. It just because it causes that grogginess and drowsiness, people feel like it just shuts them out and they can sleep.
If they are having trouble sleeping, is there another medication you recommend
Absolutely.
they take?
There are a lot of good treatments for good sleep. So sleep hygiene is number 1, setting a good bedtime routine and wake time. But as far as medications, melatonin, which is the natural hormone from the pineal gland in the brain, in small doses and gradually titrated up, they can be very safe. There's also doxylamine, which is another, although I wouldn't say it's extremely safe, that can also have side effects. It's kind of like in the Benadryl category. And then, of course, we have a lot of other, cognitive behavioral therapy, just working with a sleep specialist. There are very good treatments. There are prescription medications out there, too.
If you take Benadryl over the long run, can it have any long-term effects?
Yes, so it can cause memory issues. It can cause cognitive decline. Some of my elderly patients, I will notice that they've mentioned, oh yeah, they used to take Benadryl for years, and so there's kind of associated risks that we can notice in patients. It is been known to be linked to dementia. It can also, just in the long run, I think it's not safe to take any over-the-counter medication without the guidance of your physician or provider.
So maybe don't take it every day.
Definitely not
unless
to be
your
taken.
doctor says that's okay.
Exactly, not to be taken every day. It's not a long-term medication.
Okay, and definitely not more than what you recommended, which for a child is really like one of those pills.
One or even half. I would start with the least needed dose, and if that doesn't work, I would call the pediatrician or the family physician first.
I know it comes in a liquid a lot of times for kids, but for an adult, no more than the 2 of those pink pills.
Exactly, yes.
All right, well, thank you so much for joining us today and breaking all that down for us.
You're welcome.